Um, hi, hi everyone. Today I will tell you about the flu. Uh, uh, Flu is a respiratory illness caused by a virus. Flu is highly contagious and is normally spread by the cough and sneezes of an infected person. Although unpleasant, flu is rarely life-threatening. You can also catch flu by touching an infected person, for example, shaking hands. Or others are contagious 1 or 2 days before getting symptoms and up to 7 days after becoming ill. This means that you can spread the flu virus before you even know uh, you are infected. Now I will explain the symptoms of flu, how it's treated, how it differs from differs how it differs from a cold and the best way to prevent the flu occurring. Confusing flu with a bad cold is common. Flu and cold symptoms may both include runny nose, sore throat, and cough. And cough. Uh, to um to help you tell them apart, I there I will tell some difference from a heavy cold. High temperature, cold sweat and shivers, headache, aching joints and limbs, feeling exhausted. There may also be uh, mm, get get your get your get you in the in intestinal symptoms such as vomiting and diarrhea. There's much more common among children and adults. Normally, symptoms linger for about 1 week. However, the feeling of tiredness and gloom can continue for several weeks. Several weeks. Um, often flu. Uh, Often the uh, often early symptoms can include cough, sore throat, fever, body uh, body ache, chills, and tired. Uh, as as flu is caused by a virus, antibiotics cannot help. Only the flu had lead to another illness caused by bacteria and antivirals such as Tamiflu and Gelinzer may be maybe prescriber in some circumstances. You can use painkillers such as aspirin, but it should not be given to children under 12. Individuals with flu should stay at home, avoid contact with other people where possible, keep warm and rest, consume plenty of liquids, avoid alcohol, stop smoking, and eat if possible. It's a good idea for people that live alone to tell relative, friend, neighborhood that they have flu and make sure someone can check it on them. When to see a doctor? A doctor only needs to be informed with if the individuals is frail or elderly, their temperature remains high after 4 or 5 days. Symptoms worsen. The individual feels seriously ill. They become short of breath and develop chest pain. If you are worried, a phone call to the doctor may be better solution than making an um, appointment. Uh, in the majority of cases, flu is not serious. It is thus unpleasant for some people. However, there can be several complications. This is more likely in very young children, in the elderly, and for individuals with other long-standing illness that can undermine their immune system. Immune system. The risk, the risk, the risk of experiencing severe flu complications is higher for certain people. Others over 65, babies or young children, pregnant women, individuals with cardiovascular disease, individuals with kidney disease, people with diabetes, people taking steroids, individuals undergoing treatment for cancer. Uh, according the BBC News, over 2,000 people are hospitalized from flu complications each year, and about 36,000 people are estimated to die as a result of flu. It is estimated that globally 250,000 to 500 people die each year as a result of flu. In industrialized countries, the majority of deaths occurs among people over the age of 65. The The best way to protect oneself from catching flu is get to vaccinated every year. There are two types of vaccination: the flu shot and the nasal spray flu vaccine. The flu shot is administered with a needle, usually in the arm. It is approved for anyone older than 6 months, including healthy people and those with chronic medical condition. The nasal spray flu vaccine is vaccine made with live, weakened flu viruses that do not cause illness. A flu vaccine will contain three flu viruses: H2 and H3 and 2 virus, H1 and 2 virus, 1B virus. Protection begins by as a viruses adapt and change, so do the containers within the vaccines. vaccines, or what it include in them in based on international surveillance and scientific calculations about with virus type and strain which will circulate in a given year. Uh, okay, it's on my knowledge about the flu. So thank you for the listening.